Namaste, I'm Dr. Amita Phadnis, Pediatrics Neonatologist and Director of Oyster and Pearl Group of Hospitals, Pune. So continuing with our Aarogya Katta or this आपण म्हणू health conversations in English or health talks. We are again here with Dr. Neeraj Rayate, renowned laparoscopic surgeon. So I have a couple of questions for him. Dr. Neeraj, gallstones are pretty common and very often patients come to the doctor saying, we did a sonography and there are these gallstones. So when do gallstones become important? Are all gallstones important, or can some gallstones be laid to rest saying that we can address it later?
Thank you so much for this opportunity, madam. This is a very, very hot topic. And because of our lifestyle, a lot of sonographies show a picture of fatty liver and gallstones.
Yes, absolutely.
So when we do a sonography, what we really see in gallstones is the size of the stones, the number of the stones. And third most important thing is whether the patient is symptomatic for gallstones or not. Many a times when we do a sonography and we find a report of gallstones, we call or label these stones as asymptomatic gallstone disease. Even if the patient...
Asymptomatic means no pain,
yes,
no discomfort, no complaints.
No complaints from the patient's side.
Yes.
So even if the patient has no complaints because of the gallstones, but if the size of the stone is large, which is as per the guidelines more than 8 millimeter, or if the number of stones are many, multiple stones, then we have to consider surgical treatment. But if the size of the stone is small, less than 8 millimeter, if the number is few, or if it's like a gravel, they can be very well treated by medical management and they may not need surgery.
Great. And what are the surgical solutions for gallbladder stones?
So earlier for all gallstones, the only option was to do a surgery by conventional open method. These days, all these gallstones are treated very well with laparoscopy, which is a minimal access surgery. The biggest advantage is when we plan a surgery for gallbladder, the risk benefit is far more skewed towards the surgery. Because if we do not treat these gallstones and if we land up with an emergency situation, then the surgery becomes a conventional or an open surgery and becomes a far more traumatic for the patient.
All right. So gallstones need to be treated depending on the size and the number. And as you mentioned, gravel can be left alone and followed. So how often should, suppose you have decided that right now the patient does not need any surgery. So how often should they follow up with an ultrasound for the gallstones? What should be the interval?
So patients who are not symptomatic for gallstones and if the stone size is not very significant, we put them on medical line of management and we repeat their sonography first after 3 months to see the response.
Right.
Many a times a situation arises where the stone size decreases significantly by medical management. There are situations where the stone size doesn't change. So we continue with the medical line of management. But if the stone size is increasing, that's a sign that probably that gallbladder is not really effectively functioning or throwing or dissolving those stones. Now that's where continuing with the medical line of management is not going to help our patients. We may have to consider a surgical option for that.
Alright, so for the viewers, gallstones, the surgeon decides if a surgical management is immediately necessary or the surgeon is going to put you on conservative management, and most important, you must follow it up. Don't let an emergency arise which can create a more complicated surgery. And on the same note, if any of you feel that we should talk about certain health topics which are important for you, please feel free to give us a feedback and we will take it up. Thank you very much.
Thank you.